So Delon Human, welcome to Clearing the Air.
It's my privilege.
Can we just get a short introduction of who you are and how you came to be in the place you are now?
Well, I am a physician, first and foremost, and started my career in clinical medicine with pediatrics and general medicine, and found after a few years that I was getting frustrated because you would be telling the same story over and over to individual patients, which I love personally. But I felt that systemically one could do more. So from medical practice, I went into medical politics, and I was as the Secretary General of the World Medical Association. So this is like the mothership of physicians.
Would that be the organization that, for example, the BMA is the British
American Medical Association.
Yeah.
The World Medical Association, what is interesting is that there aren't that many physicians in the world. There are about 12 million physicians worldwide, but they have an enormous influence on not only the medical practice in a country, but also the policies, so the healthcare policies. So more often than not, you would have the president and they would have their own personal physician. So physicians and health professionals in general have a disproportionately important role in how healthcare policy is set. During that time, I also learned more about developing alliances, so helped to found the World Health Professions Alliance, which is a combination of the physicians, pharmacists, nurses, midwives, and physiotherapists. Because together, that's a powerful health professional bloc. So from health politics, I then moved on to the interface between policy, science, products that have a health impact, and the consumer, and started a company called Health Diplomats. And Health Diplomats, an attempt to help bridge the gap between the private sector and the public sector, but more importantly, to help address the most pressing social and health problems. So obviously tobacco was one, because we know there are about 1.4 billion smokers, and this was my eureka moment when I realized that as an ardent tobacco control activist, I was actually barking up at the wrong tree. And there's always a personal element, and my father was a long-term smoker, and then I was always pontificating that he should stop smoking. But I only realized when I studied the Swedish data on Snus, how wrong I had been in not firstly calmly considering the evidence before giving any sort of advice. And to this day, I would feel guilty. I feel I could have done a better job just for a person that I love. So when I think of people who smoke, I think of people with names, and I think of people who have not been told the full story. Often by health professionals that, with the best intentions, want to give the best advice, but they probably have not been. I was also very into the importance of access to healthcare information and healthcare services. I've lived part of my life in the Southern Hemisphere in a lower middle income country, and for the latter 2-3 decades in Europe, where access is not a problem. So access was another driving force in my career, if you like. So Health Diplomats has been focused as a bespoke advisory group to try and bridge, firstly, access, help improve access, not only in the tobacco control field, but in food, pharma, medical devices. And then in terms of tobacco control, and why I'm at this conference, is just to help accelerate harm reduction methods as part of tobacco control.
So we had Tiki Pang in this setting yesterday, and he said something to the effect of that the WHO's Framework Convention Secretariat have become the anti-vaxxers in this debate. I guess it's a statement you would agree with. But are there particular experiences that you've had that might serve as a good example of that in practice?
I would first like to defend the World Health Organization and especially the people who work for WHO. Nobody works or enters WHO with the intention to cause any harm. And often you see most people start at WHO with a big smile. And then after about 6 months, when they see that there is a lot of bureaucracy, which you have in any supranational agency anyway, but a lot of the bureaucracy, but I think when they are exposed to ideology and ideological barriers, that's when it becomes stressful and it causes an internal conflict. So I remember well when the Framework Convention was first developed, and at the time I was still working for the World Medical Association, and we were advocating as intensely as ever for a global international treaty to be put in place. And I'm very proud of the fact that there is something for tobacco control. The glaring omission at the time, and bear in mind when the FCTC was put in place, there were no tobacco harm reduction products or alternatives available, no smokeless nicotine alternatives at the time. It was purely a harm reduction was placed into the Framework Convention, Article 1D, because it was in parallel to what was happening in the world of HIV/AIDS, where we understood from a public health perspective that harm reduction is a powerful tool. So unfortunately, fast forward to today, you have a Framework Convention that actually does have in its substance the provision for harm reduction methods, but it is not recognized and it's certainly not studied the way it should be. And that, I think, the most harmful is that we now have had 10 to 15 years of national level data that can be studied, in addition to what happened in Sweden. And that has not happened. And that to me is a criminal offense. You can have an opinion as long as it's evidence-based. And from that point of view, I'd say WHO is neglecting their duty. They still have a way to get out of this self-induced error, and that is to do a serious elaboration of what harm reduction could mean in tobacco control. But for that to happen, they would have to overcome all of the ideological and financial barriers that they faced.
So let's talk a little bit about those financial barriers, or that Michael Bloomberg-shaped financial barrier, because it keeps being brought up by people who have experience of World Health Organization politics. So I've had a few of them on over the last couple of days. It does seem to be somewhat of a subversion of democracy that the peculiar tastes of one very rich man is dictating the global narrative on harm reduction in the nicotine space, and yet it is happening. And it's difficult to come to any conclusion other than people who should know better have looked at the evidence and then looked at the size of the check on offer and gone with the check.
Yes.
And yet you say you will go out of your way to defend the people who work at the World Health Organization. How do you bring those two opposing thoughts together?
Well, in studying the motive of firstly Mr. Bloomberg and then those who work within WHO, and let's call it the WHO Bloomberg Gates complex, I'd say that for Mr. Bloomberg himself, billionaires tend to work in tribes, and at the time when Bloomberg became interested in healthcare, at global health, and started investing, there was initial pure joy, because what the countries were not willing to invest themselves, suddenly here was somebody with billions who was willing to invest in global health. Some of these billions have had remarkable return on investment. Between him and Bill Gates, the Bill and Melinda Gates Foundation at the time, they sort of divided the world into non-communicable diseases and communicable diseases. and the Gateses went more for the communicable diseases. And I'd say both philanthropic structures have made a net positive contribution to global health as a whole. But in terms of tobacco control, there's been an enormous deficit in what could have been done if Mr. Bloomberg had just simply done for harm reduction in tobacco control what he's been doing for harm reduction in drug control in the United States. They simply have to take the same recipes of harm reduction that they've employed in the US and employ that globally to tobacco control. We would have hundreds of millions of lives would be saved. A former WHO leader, Derek Yach, and myself, we did a number of studies to determine how many lives could be saved if individual nations were to embrace tobacco harm reduction and add to that earlier diagnosis of lung cancer. The global number is at least 100 million up to 2060, which is enormous.
Cover the research.
More than 100 million people with names and families, hopes and dreams, could be saved if tobacco harm reduction were to be adopted. And then for specific countries, for Indonesia, for instance, where you have a 60% smoking prevalence, you'd have 5 million people that could be saved. So for each of these countries, there's a number of people that could be saved. Now, the question is, why hasn't Mr. Bloomberg's intellectual advisors given him that data to have a better understanding of the principle that it's not really it's not an either-or situation. It's not a let's go classic tobacco control. They could do both. They could continue with their tobacco control efforts, but just take on harm reduction as well. The individuals within that system, unfortunately, are well paid, and I would agree that it's probably the financial capture. If you are working for an NGO, you don't have to do any science. Your only real job is to name and shame those that embrace tobacco harm reduction or go to a conference like this one, and you get good money for it. Then you get complacent and you think, well, that's what life is all about. You're saving the world by naming and shaming people. What you certainly aren't doing is doing science. So I would take serious issue with that. And for any of the antis who would put my name on a site and say, well, I've been to this and this conference and I spoke in favor of tobacco harm reduction, my plea would be, please look at the data. And if you are not in agreement with what we've said about the potential lives to be saved, replicate or duplicate or do other science to refute that kind of numbers.
And of course, the problem is that they're not going to listen to you. They're not going to hear what you say. They're not going to take your arguments seriously because they think that you and I have horns and sleep in coffin. That's just the way it is. And the view I've come to is that, and I said it on stage yesterday, every single industry conference I've ever been to in the 13, 14 years or whatever it is, there's always somebody, somebody on my panel, it was Michael Rearink this time, but there's always somebody who said, we're here in our silos and we all need to break out of our silos and talk to each other and come to some kind of consensus. And every time somebody says that, my eyes roll back in my head and I just think it's not going to happen. Can we stop pretending that it's even an option? So if we accept my premise that that is not an option, what is then left other than incredibly aggressive personal campaigning that almost replicates what they're doing?
I would push back slightly on your frustration. On the one hand, I share your frustration 100%, Peter. So it's not that we're not all frustrated. But to push back slightly, I would see it as playing the long game more effectively. When we started this 15 years ago, when I take it back 15 years, to more or less when smokeless nicotine alternatives were on the market. So it wasn't a hypothetical discussion anymore. It was a practical, pragmatic choice that individual people who smoke could make and eventually nations could make as part of their regulation. We do have more than 130 million consumers of smokeless nicotine alternatives, which is huge. And we do have companies who've invested billions in innovating new products, and we've seen how the products have improved. So technically we have the fire escapes available, but the narrative is still quite lacking. And my experience has been that confrontation rarely works.
But it works for the other side.
It works for the other side for the moment. But I'd say that confrontation in a more intelligent drone warfare would probably be more effective over the longer term. I think we've tried to knock on the front door of WHO and the big nations. And we've tried to enter the front door and tell them that here's the solution. This will decrease tobacco-related disease, death, disability. It will bring down your costs. And we're trying to persuade them at the front door. I would say that an aggressive approach via the side doors is probably where we need to focus on next. So a few simple examples. If you take wound care, so if you've been in medicine and you do elective surgery, or if you treat patients with chronic wounds, for instance, because of diabetes, and they get chronic foot ulcers, if a person with wounds smoke, it is like a death sentence to that wound. You get decreased wound recovery. More often than not, you get amputations of limbs because of the bad wounds. So if you can prove the case in a smaller subset of medicine, say wound care, and you build a faculty of health professionals to actually take this seriously, then I think we will have more success.
Why is this not taking place in mental health? That seems to me to be the obvious starting point.
Oh, that's a brilliant point. You're correct. If you take mental health institutions, you would find that the smoking prevalence in the UK, for one, as documented by the Royal College of Physicians, but if you take most mental health institutions worldwide, there'll be between 70 and 80% smoking prevalence. And people in these institutions smoke as a coping mechanism. And this should be seriously considered in their overarching treatment or care plan. So that should be a start.
The premise that a lot of physicians will walk into a consultation with somebody with serious mental health issues will be, this person is not acting rationally. But I would suggest maybe 70–80% of patients who have been committed to inpatient psychological care smoke. There must be a rationale. It must be a rational decision to use nicotine for those people.
I would agree with you. And I wouldn't agree that physicians or health professionals would think, well, the person in the mental health facility is acting irrationally. And more often than not, if that person is not actually smoking, they are doing much worse. They are not coping. You get more conflict, you get more issues within that institution. So more often than not, it's a pragmatic decision from both sides, both the carer and those who are being cared for. But I take your point and agree with you that mental health is one of the very first subsets of individual health and public health that we need to address. And may I just emphasize the difference between individual health and public health. So as a physician, you look after individuals, and individual health really does matter. When you're in public health, you get excited when more than 1,000 people die of something like COVID. And that's always, to me, has been a false division of labor. Both need to be taken into account, for mental health especially. Because if you have a person with schizophrenia, maybe coupled with some other chronic disease, then smoking is a very important, or nicotine is a very important way for them to cope.
It's a rational choice.
It's a rational, and I would say an evidence-based choice.
And it's not confined to people who require inpatient care. I tell my own story all over the place. You know, I was diagnosed with ADHD when I was, how old was I? 8. And the nicotine worked far better than the Adderall ever did. So I started smoking at 11. It seemed to me to be a perfectly rational choice at the time. It was essentially self-medication. I don't want to give up. using nicotine. I don't feel like, I think that would be an irrational choice for me. And yet we are told, even by the tobacco business, and I think this is a huge strategic mistake, we are told if you don't use nicotine, that is the optimal state for you. I don't believe that. I think that's wrong. I don't mind saying it publicly. Why are businesses and advocates always so keen to stress this point that the optimal state for everybody is zero nicotine use, when there is so much lived experience out there that tells us that this is just not the case?
Well, in terms of the reason why health bodies would say that it's not a tobacco-free world, but we need a nicotine-free world, is to me the misperception and the misunderstanding of the difference between addiction and dependence. So all of us, all human beings, have a dependence on some activity or substance. There are 2 billion cups of coffee that are drunk every day. And we don't talk about addiction to coffee and that we need a coffee-free world. Nicotine is another active molecule that has a health impact, but we all agree that if it's delivered as part of a cigarette, that it is highly addictive. There's no dissensus about that. But in terms of nicotine in a smokeless delivery system, like an oral nicotine pouch, a heated tobacco product, or electronic cigarette, this can be characterized more as a dependence-forming activity. And if you were my patient, I would have absolutely no hesitation to say, well, Peter, you have found your way of coping and self-medicating and treating your own ADHD, and continue. Obviously, you'd want to go through all the alternatives, but you have found a way that has worked for you. But there are millions of other Peters with the same problem out there. Why can't we have the same kind of robust research to actually validate this and make sure that the treatments given or the advice given is evidence-based and pragmatic?
Because no business is ever going to be able to sell to investors the financing of a clinical trial for nicotine to treat ADHD in adolescents, because they know that the regulator is going to take one look at it and laugh them out of the room.
No, in terms of age restrictions, I fully understand that. I agree with that. But for people older than 18 years old, when you said you started smoking at 11. So when you were 18 years old, did anybody tell you or give you a balanced recommendation on how to use nicotine or not? Now, that to me is a failing of the system.
I was 18 in 2004, so there weren't very many options in the UK in 2004.
Yes. But now, if you were 18 in the UK now, you could become part of Swap to Stop, and you would be encouraged by a system which now recognizes harm reduction. But that didn't come easily. So I think the UK is actually a good example of a country where there was first vehement opposition to any form of electronic nicotine delivery system, such as e-cigarettes. And then there was a period of reflection and eventually a very robust evaluation of the evidence. NICE was part of that, the Royal College of Physicians was part of that, and eventually the collective realization that this is actually part of the solution has come to pass. And in the UK, at least, this is a progressive system where access is not denied. New Zealand is another country where the same pattern was followed. First opposition, then there was a period of proper research, and now there is progressive tobacco harm reduction friendly regulation in place. New Zealand is not applauded for that. In fact,
they were given the dirty ashtray.
They were given the dirty ashtray.
For readers and listeners who do not know what the Dirty Ashtray Award is, can you please briefly explain it?
Well, at the Framework Convention, at the Conference of Parties, and we've now had 11 of them, but what was decided by the Framework Convention Alliance, which is a group of about 500 not-for-profits who are allowed to be inside the room as part of COP, they wanted to show up countries who deemed to talk either neutral or positive language about tobacco harm reduction. And for those countries that were obviously not aligning with the Framework Convention, they wanted to name and shame them. So the dirty ashtray was developed as a sort of a name and shame instrument to get member states to fall in line. And unfortunately, last year, the New Zealanders, who were probably the one country that gave the most balanced view on tobacco harm reduction of all the assembled member states, they were given this award.
Just want to tie it up by talking a little bit about Smokefree Sweden,
Sure.
which is a campaign that Health Diplomats has led and is probably the best one I've seen of its kind.
Sure.
We think it's brilliant. What was the inspiration for that? And how did that come into being?
There was one personal dimension to this, and then there's a pragmatic professional dimension. The personal dimension was that I had not advised my father anything other than what the Quit or Die Brigade would do today, which is you stop all smoking, you stop all nicotine, or you die. And it was only when I was part of the World Medical Association and I saw the statistics on snus. At that time, it was already 30, 40 years of decent data that had been built up to see that it was clear that the Swedes had at least 40% less lung cancer, at least 60% less total deaths of cancer. They had less smoking-related heart and lung disease while using the same level of nicotine. So it's pretty obvious that the Swedes had something right. What I couldn't understand was that snus was banned in the EU, with the exception being Sweden, but nobody spoke about this fire escape. So with a number of Swedish stakeholders that over the years we've been working together, we decided to actually brand this phenomenon and tell the story. And not just tell the story in a bland way, but to make incisive forays into the different data sets within Sweden to show that not only is there decreased disease, disability, and premature death in Sweden, but there is so much to learn of how the Swedish consumers use smoke-free nicotine alternatives. So women, for instance, Swedish women, the fact that the normal brown snus, as they call it, tobacco-filled snus, was mainly a male consumer habit. But when white snus came along, which is oral nicotine pouches, suddenly Swedish women used that as their form of switching or quitting. So we developed several reports on showing how Sweden compares to other EU countries and then to several other countries worldwide. And then A Power in a Pouch was a report on the uptake of oral nicotine pouches by Swedish women. And the idea was to have small bite-sized data sets told in a gripping story so that policymakers could actually see what was going on. One of the revelations was that initially the Swedish government, the Swedish policymakers themselves, were not celebrating as if they were victors in the story. And it was only after about Smokefree Sweden's now in its 5th year. It's only after about 4 years that we saw that we were making headway, that the Swedish policymakers were beginning to believe. You saw that today with Charlie Verhammer's.
We had him here about an hour ago.
In them, they are articulating the story in exactly the way that it should be, a balanced policymaker view on what good policy should do and what bad policy should be abolished. So Smokefree Sweden is a way in which we want to showcase best practice, but we'd like to go beyond that and perhaps have the story of Japan be told. You know, what is Smoke-Free Japan? What does that look like? Smoke-Free New Zealand. And that's the only way that you can break the deadlock, the current deadlock, where ideology is trumping all rational scientific debate.
And last question, sort of related. You and I both have our own page on the University of Bath's Tobacco Tactics.
Yeah.
I believe it's called. I worked for Juul, and you've had relationships with other such companies as well. And part of what I think the problem is that people like you, and I don't know if you have been too apologetic about it, but maybe I have been. But actually, it's the only way that we're going to get this message financed properly. And it's an important message. And frankly, if we could both be doing other things with our lives if we wanted to be.
Absolutely.
But there is this fear about being seen to be too close to the industry. And I think that gets in the way of work being done. And, I hope one day, we can sort of stand up and say, yes, you've taken money from the tobacco industry because they wanted to pay me to say the things that I think. That is not a problem. Do you think we're ever going to be able to convince people who need a megaphone that it's not career death to take a little bit of money from the tobacco industry, as long as they're not telling you what to do with it?
Well, Peter, I've been involved in several industries. I've been involved in the alcohol industry, the food industry, the cannabis industry, and it's always been with the approach of finding the balanced, evidence-based way in which to use products that have a health impact. And I've worked in each of these industries, sometimes as part of a contract with one of the companies as part of the industry, but mostly it was just a personal journey to make sure that population health can be done in the correct way, especially those areas where the solutions are so obvious. Now, whether we appear on a tobacco tactics page or not, over time that won't really matter, and I'm often really surprised that they take so much. They make absolutely sure that whatever you do or you say is on your page. I have to go and see where last they saw me.
I was almost offended that I didn't have my own page for so many years.
And you have one now.
I sort of have one now. Clearing the Air has one. We'll reference on some other pages, but I take it as a badge of honor. I think if what I'm saying is annoying people who, frankly, don't like smokers as people, and I genuinely, maybe we'll finish on this point, I don't think that they like me because I don't conform to their idea of how people should live, because I use nicotine and I'm unapologetic about it. And I think they have a genuine dislike for my life choices. They don't like the way, even if I wasn't in this industry, I just don't think that they like the way that I live, and I'm an inconvenient blocker on them creating the world that they believe should exist. And I think a lot of smokers feel like that. I don't even really have a question. I just wanted to say that. Is it something that you've noticed?
Well, to me, the sad part is that all the money that they're receiving to have these big websites and searches and then the name and shame campaigns.
Yeah, crap websites, by the way, really badly built.
They should just use the money to serve people. I mean, if they want to name and shame people that are acting in bad faith, fair game. But if they are attacking people who are asking for proper evidence-based, risk-proportionate regulation for tobacco and nicotine products, that I don't understand. And they should rather employ their money and their funding and convince Mr. Bloomberg that that's the better way to combine both tobacco control, which they are attempting to do, and harm reduction. It's a win-win. I don't see them as opposition. I'd like to bring them on board and just make use of their resources in a more pragmatic way.
Delon, it's been great very much.
Thank you.